Now, the last topic in this chapter of lens and cataracts is Ectopia lentis. What is Ectopia lentis? It is Ectopia lentis. It is the partial or complete dislocation of the lens from its normal position. Okay, it can be partially dislocated, or the lens can completely dislocated into the interior chamber or posterior chamber. Okay, so this dislocation of the lens is called Ectopia lentis. It can be partial dislocation, which is called subluxation, and it can be complete dislocation, which is luxation of the lens. So why the lens is dislocating? Etiologies. It can be due to the hereditary conditions and acquired conditions. Okay, we have multiple hereditary pathologies, such as the first one is the Marfan syndrome. In the Marfan syndrome, it is a hereditary condition in which there is the ocular, systemic, and cardiac abnormalities. Okay, so the ocular features of the Marfan syndrome are: there will be the partial dislocation, superior temporal partial dislocation of the lens. As this is the lens, for example, if these are the zonular fibers. Okay, this is the lens will dislocate superiorly and temporally. Okay, and remember, these lens fibers in Marfan syndrome, the zonules, these will intact. Okay, they will not be ruptured, and we will have associated other ocular symptoms like axial myopia, glaucoma, and retinal detachment. Okay, so these are the ocular features of Marfan syndrome. The systemic features are: in Marfan syndrome, we have the long limbs. Okay, the limbs are long, and the joints, they are laxed. So long limbs with laxed joints, and there will be kyphoscoliosis. Kyphosis means there is the deviation of the spine like this. So the spine will be upward deviated. This is kyphosis. Scoliosis means the spine will be deviated sidewise. This is scoliosis. Okay, so we will have kyphosis or scoliosis. Okay, so we will have kyphoscoliosis and Marfan syndromes, and we will have arachnodactyly. What is arachnodactyly? The fingers, the toes in the fingers, they will be longer than the circumference of the palm in sole. Okay, the fingers will be longer. And the cardiac symptoms are: in the Marfan syndrome, the cardiac symptoms are aortic dilation and aneurysms. Okay. Now the second syndrome is Weil-Marchesani syndrome. Weil-Marchesani syndrome. It is characterized by the inferior interior dislocation of the lens. The lens will dislocate it. Okay. It will dislocate interiorly. Why? Interiorly into the chamber. Okay. Interiorly into this interior chamber, interiorly and inferiorly. Okay, so inferior dislocation of the lens. Why interiorly? The lens is microspiropakia. Microspiropakia means the lens is smaller than normal. Okay, so that's why it will dislocate interiorly and inferiorly. This is Weil-Marchesani syndrome. Now the next metabolic error is in which there is the dislocation is homocystinuria. Homocystinuria, we have the deficiency of an enzyme called cystathione beta synthase. Okay, so cystathione beta synthase, when there is the deficiency, we will have ocular features like we will have the dislocation, but the dislocation is opposite to the Marfan syndrome. The dislocation is now inferior and nasal. We have the inferior nasal dislocation, which is opposite to the Marfan syndrome, Ectopia lentis. Okay, so there will be the lens will be dislocated inferiorly and nasally. And remember, the zonular fibers in this case, they will rupture. Okay, the zonular fibers are ruptured. Okay, in Marfan and homocystinuria. And other ocular features like the myopia, the glaucoma, retinal detachment are similar as in Marfan syndrome. So we will have interior, we will have the lens will dislocated inferiorly and nasally. Inferior nasal dislocation, myopia, glaucoma, retinal detachment. Okay, and the zonular, they will be ruptured. These are the symptoms, ocular symptoms of homocystinuria. Now we we have another inborn error of metabolism, which is sulfide oxidase deficiency. In sulfide oxidase deficiency, there is a lens dislocation. Ectopia lentis is a universal finding. Okay, and these patients they live only for a couple of years. Okay, so their lifespan is very short. And the last hereditary condition in which there is a dislocation is hyperlycinemia, in which the lysine will be more in the blood. Okay, this is due to the deficiency of an enzyme called lysine alpha ketoglutarate reductase. This enzyme, when deficient, it will cause increased hyperlysine in the blood, lysine amino acid. Okay, and will cause ectopia lentis. So these are few of the hereditary condition in which we have the dislocation of the lens and ectopia lentis. Okay, now we can have acquired conditions. Okay, as previously we discussed it in hypermature cataract, the lens shrinks. Okay, and this shrinks lens will, so its size will be reduced, and due to this reduction of size, it can dislocate into the anterior chamber and posterior chamber. Okay, and the injuries in the acquired cases, injuries can also cause this dislocation of lens. And we have the ophthalmos, in which we have congenitally enlarged eye. Okay, and enlarged eye, there is the risk of zellular rupture and dislocation of lens. And we can have an axial myopia. And axial myopia, we also have an enlarged eye. So in an axial myopia, ophthalmos, due to the enlarged eye, the zellular ruptures can occur, and it will lead to ectopia lentis. Okay. So these are some of the hereditary causes and acquired causes of the dislocation of the lens, ectopia lentis. What is the treatment? What are the symptoms? How the patient will present to us? If the lens is present right over here, or right over here, or right over here, what will happen? The visual, there will be the halos, double vision, even multiple vision, and blurred vision, and distort visions. Okay, so there will be the multiple problems with the dislocation of the lens. How can we treat the condition? The condition can be treated by convex lenses, or we will remove. The treatment is the spectacle or surgical removal of the dislocated lens. Okay, so this was about the ectopia lentis, and this chapter has been done, lens and cataract. Next day we will start another chapter. Thanks for watching the video. I also have prepared notes. I will give you the link in the description. You can go through the notes and can learn more.